This is Radio Health Journal. I'm Reed Pence. This week, the desperation of not being able to afford the drugs that keep you alive.
It's not just being sick, it's the stress that comes with the prices of these drugs that makes you feel worse.
Skipping doses, splitting pills, and never filling prescriptions at all. When Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
We need to talk about real issues in science fiction, including race. You can't just erase this question. And so much of her work was in part about writing herself and people like her into a future that didn't necessarily have a ton of place for them.
Lost races of science fiction. Then,
it's the exact opposite of a dysfunctional family. That's why I loved it as a kid.
The Honey Bus, a memoir of loss, courage, and a girl saved by bees. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes and Stitcher.
68-year-old David Mitchell says he's a lucky man. He's alive today because of modern medicine.
I have an incurable blood cancer called multiple myeloma. It's incurable, but it's treatable for some period of time with very expensive drugs. The current two-drug combination I am on has a price of $325,000 a year.
Mitchell is the founder of the advocacy group Patients for Affordable Drugs, and he says the only reason his drugs are affordable is because of his insurance and the fact that his medications don't come as a pill.
These are infused drugs, and I can buy what is called a Part B supplement for $2,500 a year that covers my out-of-pockets. But for many people, it's impossible to pay that much for a supplemental policy in addition to what they pay for Medicare. And if they're on Medicare Part D, which covers retail drugs, oral drugs, by and large, the out-of-pockets can run to as much as $15,000 a year in Medicare.
But even those people are lucky compared to people with no insurance or a very high deductible plan. For them, the cost of medication may be simply out of reach. Dr. Stacy Dusitzina is Associate Professor of Health Policy at the Vanderbilt University School of Medicine, who's studied how drug costs affect compliance.
Particularly for people paying over $100 or $500 per month, for example, which could be a lot of people in high-deductible health plans right now. We do see that those people are much more likely to just not fill their prescriptions.
A study in Annals of Internal Medicine shows that up to 30% of prescriptions are never filled. Cost isn't the only reason, but it's a big one.
The prices have been going up, at least the list prices of the drugs, the prices that consumers are facing. But also the other part is that insurance benefits have changed so that more people are having to pay the full price of their drugs. As the price goes up, patients stop taking their medications as prescribed. And as you could imagine, a lot of that depends on how much money you have left over to spend on medicines at the end of any given month. There are some statistics out there that a large part of the country, people don't have more than $400 in savings. So for someone in that situation, even being asked to pay $50, for example, for a fill of drugs could be a real burden. We've seen that people, about 1 in 4, so 25% of people or so, say that they have trouble filling their medications and do things like splitting pills or even taking pills that other people have as a way to deal with the cost of their drugs.
The CDC just issued a report that found that 10% of people in the United States actually, more than 10% actually, ration their drugs. They don't take as much as they are prescribed as a way of stretching out the amount of drug they have so they don't have to go buy more. Cutting pills in half, skipping doses, choosing between food and drugs, people going into bankruptcy because of their drugs, losing their homes because of the price of their drugs. These are all situations that are common across the United States today.
Dusitzina says price makes more of a difference for people with chronic conditions.
People are being asked to take drugs for the long haul. You take them every month, for example, for the rest of your life. So we're asking people to pay more frequently because they're using drugs more. This also shows up, though, in places like cancer treatment. So if people are being asked to pay a lot of money for cancer treatments, we've done some studies on this and found that even paying more than $50 out of pocket per month for a cancer drug, a lot of people weren't able to stay on their treatments as prescribed. So I think it goes across the board, but as you could imagine, the more drugs that you need and also the longer you need to take them, the more likely you are to run into these problems.
And obviously, not taking meds will have an effect on people's health. Drugs don't work if you don't take them.
This is a very dangerous thing for people with certain kinds of conditions. The one that comes to mind most quickly is insulin-dependent diabetes. Insulin is required for those people to live, and when they start stretching out their dose and not taking enough, they risk going into insulin shock and dying. In fact, people have died from not using insulin as much as they should because they could not afford to.
However, a lot of people figure there will be enough benefit to get by if they take half of their medication. But Dusitzina says sometimes a little dose is worse than none at all.
There are some drugs where if you take less than prescribed, you could actually develop resistance to that treatment, so it wouldn't work for you any longer. So there are definitely cases where taking part of your fill is actually maybe even more harmful than taking none of your fill.
And then there's the psychological wear and tear of living on the financial edge with a disease or disorder looming over you as well. Mitchell says one feeds off the other.
The financial stress contributes even more to bad health. People who are trying to manage an acute condition, who are very sick, they get cancer, to have the additional stress of drugs that are so costly can be terrible. Sometimes it's not just being sick, it's the stress that comes with the prices of these drugs that makes you feel worse.
You might assume that doctors take cost into consideration when prescribing and give the patient the least expensive treatment that will do the job. But that's not really what happens. Dusitzina says sometimes doctors don't even think about cost.
I think there has always been this assumption that you prescribe something for a patient and then they're able to go out and fill it and take it as prescribed and they'll get better or at least not get worse. And I think that once you start to hear that a lot of people are struggling to fill their medications, and sometimes even in really serious conditions like cancer or insulin, for having insulin use, for example, that's highly alarming. Doctors want patients to be using the medicines as prescribed so they get the benefit, but there are also cases like we're seeing today with people who are doing things like rationing insulin, which can threaten their lives.
Fortunately, since it's become such a big issue, doctors are thinking a lot more about how drug costs impact patients. But even when they think about it, doctors may find that they can make no assumptions.
You can't blame the doctors for this because the amount that you would have to pay for a given drug, depending on whether you are insured and what kind of insurance you have, may be completely different than the amount I might have to pay for the very same drug. And it's worth noting in this regard that the Department of Health and Human Services is working toward a day when a doctor will be able to take your insurance card in his office or her office and input your insurance number and get the exact price of a drug that he or she is about to prescribe to you in real time. And that would be incredibly beneficial for medical professionals and for patients because at the moment that the prescription is being written and the choice of drug is being made, the medical professional will be able to find out right then what you specifically with your insurance will have to pay for this drug.
However, since that system isn't available yet, Dusitzina says the best thing patients can do is, if cost is a problem, ask if there are lower-cost options.
It's also an important thing for patients to talk with their physicians about and also to talk with their pharmacists about. Because in some cases, if patients are finding that their drugs are unaffordable, if they talk with their physician or talk with their pharmacist, they may be able to find a cheaper option. That's not true in all cases, but in some cases it is, and that's something that needs to start occurring. Rather than splitting pills or not taking the therapies that have been prescribed, let people know and get some help maybe trying to work out how to get a drug that's more affordable for you.
However, the CDC says that among people who have no insurance and are under the greatest cost pressure, some 60% have not asked if there's a cheaper option. Mitchell says that's understandable.
Especially if you're sick, like not just managing a chronic condition, you're sick, and your doctor writes you a prescription and says you need to go get these drugs. At the moment, you're thinking, how do I get better? And my doctor said I should take these drugs, and you go do it. The other thing is it's hard for people to shop around. You know, drug prices can vary from drugstore to mail order to a different drugstore. Also, drug prices vary depending on whether you have insurance, don't have insurance, the type of insurance you have. So it is difficult for people, frankly, given our system that is so complicated, to shop. But I think from a point of view of someone who's sick, and I mean scared sick, you tend to take the advice of your doctor and depend on them to pick the right drugs.
Now, you'd think that a lot of the time it would save an insurer money to make sure their patients take their meds and avoid the cost of more serious illness, even to the point of making the drugs free. Dusitzina agrees to a point.
There are definitely clinical areas where we know if you can get people to consistently take the medications, that you can save money on things like going to the hospital or going to the emergency room. But there are a lot of complicated factors there. So in some cases, like in the Medicare Part D benefit for seniors, those benefits are usually not tied to your medical benefit. So saving money on one part of the benefit doesn't really help the same health plan if you save money for Medicare, for example. So it ends up being a little complicated. But by and large, I think that is true, that we have a lot of clinical areas, and diabetes is a great example, where if you make sure that people can take the medication and afford to do that, you can save money in the long run.
Insurers obviously have a huge stake in how people feel about the affordability of drugs, and people are not happy. So policymakers, for the first time, have begun to seriously consider Medicare for All plans, which would put insurers out of business. However, in considering why people don't take their medications as they should, cost is far from the only factor. Sometimes they feel better and don't think they need their drugs anymore, or they don't feel worse if they don't take them. Sometimes people simply don't want to be reminded that they're sick. But cost is one more hurdle to get past, and a lot of the time it's the one they can't control. You can find out more about all of our guests on our webpage, radiohealthjournal.net. I'm Reed Pence.
Coming up, brain aneurysms when Radio Health Journal continues.
May is American Stroke Month, and while not all strokes can be prevented, up to 80%, including recurrent strokes, may be, with a few changes, like not smoking, eating healthfully, being physically active, and maintaining a healthy weight. People who've survived one stroke are at a higher risk of having another, according to Dr. Mitchell Elkind of Columbia University.
About 1 in every 4 stroke survivors will have another one. The best way to reduce your stroke risk is to live a healthy lifestyle and work with your doctor on a prevention plan. Also, ask your doctor if a daily aspirin or other medications for secondary stroke prevention are right for you.
More than 116 million people in the U.S. have high blood pressure, and fewer than half have it under control, putting them at increased stroke risk. Nothing causes more strokes than uncontrolled high blood pressure. Learn more at strokeassociation.org/stroke month.
If you listen to this program regularly, you probably know that this is National Blood Pressure Awareness Month. So, do you know your numbers? We know our phone numbers, our birth dates, our height and weight, but oddly, no one knows their blood pressure numbers. And you need to. That's the whole message from 120 Life, a new natural juice drink created to help improve your numbers. Doctors have known for years that substances like pomegranate, tart cherries, and teas can lower blood pressure naturally. 120 Life blended them together. When using it with other common sense measures, many have seen better numbers within just 14 days. For how it works and what it might mean for you, visit their website, 120life.com. That's 120life.com, and sign up for the Better Numbers in 2 Weeks trial pack. But you can do that tomorrow. What they want you to do today is find out your numbers.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.